very good afternoon and warm welcome to all our viewers. My name is Diwali Safaya and I welcome you all to We Talk to You show, a show by Puberty to Menopause, a public health awareness initiative by Human Biological Institute. Puberty to Menopause is yet another platform created by Human Biological Institute where we try to provide expert medical advice and create awareness on women's health. It's my pleasure to take this opportunity and share about Human Biological Institute. Human Biologicals Institute, a division of Indian Immunologicals Limited, shaping global healthcare by spearheading the One Health initiative. Indian Immunological Limited was established by the National Dairy Development Board (NDDB) in 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biological Institute was established in the year 1998 when the Government of India requested Indian Immunological Limited to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biological Institute was established at Ooty. This facility is one of its kind in India to have rolled out first cell culture rabies vaccine in 2000. Subsequently, Human Biological Institute has launched other vaccines and currently we are the major player in human vaccines. We are the leader in anti-rabies vaccine segment and present in around 60 countries. We are three state-of-the-art manufacturing facilities at Ooty, Gachibowli and Karkapatla, also known as Genome Valley. Human Biological Institute has forayed into the market of clinically proven wellness products and infertility ranges of hormones. Coming to our vision, mission, and value, our vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. Our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' needs. As we know, we are the kind of company who will definitely look after taking care of environment as well. We proudly bring before you the Green Initiative. As we have launched our flagship brand anti-rabies vaccine Abhayara, and with this we have taken significant step to reduce the plastic burden by 160 ton per annum. Well, coming to our corporate social responsibility. As a company, we don't just manufacture and market products, but Human Biological Institute has done a lot in corporate social responsibility and has taken up various projects. One such project is adoption of government school. Another program is gift meal program in coordination with National Dairy Development Board. We are giving additional nutritional supplement to over 1600 school-going children of Telangana and Tamil Nadu. We have also facilitated the setup of an oxygen generation plant at the Telangana Institute of Medical Sciences, Gachibowli. The unique advantage of this oxygen plant is that it is capable of supplying oxygen to 70 patients at a time. You can visit us on our website www.indiaimmune.com. You can contact us on our toll-free number 1800-313-999977. You can follow us on LinkedIn, YouTube, Facebook, Instagram, and Twitter. Also, you can go through a unique initiative on fight against rabies at www.fearlessagainstrabies.com and everything you want to know about women health on www.pubertytomenopause.com. So once again, I welcome all our viewers who have joined us live today. Well, in today's show, we are going to talk about a very important topic, which is understanding the impact of age on female fertility. Well, age has a significant impact on female fertility. As women age, their fertility gradually declines, and the chances of conception and successful pregnancy decreases. So to understand more about this topic and to know more, for this we have a very special guest with us today. Please welcome Dr. Moonmoon Agarwal. Dr. Moonmoon Agarwal is a distinguished gynecologist and infertility specialist at Sri Dhanvantri IVF Center in Raipur. With extensive medical education and training, including fellowship in reproductive medicine, Dr. Agarwal is highly skilled in treating gynecological conditions and addressing fertility issues. Her compassionate and patient-centric approach, combined with her expertise in advanced reproductive treatments, has helped numerous individuals and couples on their path to parenthood. Dr. Agarwal's dedication to staying to the forefront of reproductive medicine ensures that the patient receives the best possible care and support. She's a valuable member of the medical community and provides hope and assistance to those in need. A very warm welcome, Dr.
Thank you.
Moonmoon.
Yeah, hi. Thank you for such kind words.
Welcome to our Puberty to Menopause We Talk Do You show. Doctor, I want to ask you few questions regarding the topic. The first question I want to
Sure.
ask you is that,
Yeah.
Doctor, what can be the basic primary causes of age-related decline in female fertility?
See, we all know that females do have a biological clock. We have been hearing this since the beginning. And unfortunately, for females, the biological clock and the career clocks go in different directions. Anyway, so coming to the biological clock, what happens in female with age, the ovarian reserves decrease. As the female crosses the age of 30, and then beyond 35, the number of eggs as well as the quality of eggs is affected. And hence, the chances of getting pregnant decrease. So, yeah. And with age, then there are many diseases which come up, which again affects the pregnancy of the female. Uh, Even when they get pregnant, there are chances of abortions, complications. Yes, but with the movement and with the advancement in the ART, we are helping elder women to get pregnant.
Thank you, doctor, for answering this. The next question I want to ask you is, as you mentioned about the age. So, doctor, what is exactly the relationship between the advanced maternal age and the risk of miscarriage, and why does the risk increase as the women get older?
Yeah, so as I had mentioned you earlier, the quality of the egg, as the age increases in the female, the quality of the egg is also affected. So what happens? There is chromosomal abnormalities in the egg, which is formed at a elder age, like beyond 30, 35. So when the embryo is formed, it is genetically deformed. So hence, there are higher chances of miscarriages because it's nature way of saying that this embryo will not be a healthy baby. Hence, it should not be allowed to grow. So yes, so there is defect in the genetic problem, defect in the genes because of the age, and then which leads to a defective embryo and hence a miscarriage.
Uh, Thank you, doctor. This again a similar question I want to ask you with this respective is, as you mentioned about the relationship between the advanced middle age. So the quality and quantity of eggs is also affected, and exactly what roles these factors play in age-related infertility.
See, we all females are born with a particular ovarian reserve. From our birth till our puberty, we lose some amount of eggs. Then from puberty, as we keep on aging, every month we are losing some eggs. So our reserve is limited. Hence, beyond the age of 30, it gets very limited, and that is how the ovarian reserve decreases.
Okay.
So
Yes, doctor.
yeah, it's important for females to understand that you cannot postpone your pregnancy.
As you said about the impact on the women's egg, so doctor, what are the possible common medical conditions which are associated with age-related infertility in women?
Again, as the female age, there are high chances of diabetes, blood pressure, thyroid disorders. Again, these are the complications which can get exaggerated during pregnancy. And then again, as we had discussed earlier, high risk of abortions, all trimester abortions. In fact, first trimester, second trimester, the uterus gets weak, so second trimester abortion is also common. So yeah, these are the medical conditions which we need to look for in a elderly pregnant lady.
So Doctor, as you're mentioning about the conditions, so can you explain more that how do they affect fertility and conception?
Again, now we need to understand. See, as we all know, India is known as the capital of diabetes. Now, we are in very younger age, we are seeing diabetes in young patients with so much of stress factor, even in females. And because also of polycystic ovaries, that is also associated with insulin resistance. And hence, in earlier stages, it's just polycystic ovaries. And as they go beyond the age of 30, they are diabetic. They become diabetic. So diabetes. Now, diabetes very badly affects again the quality, affecting the chromosomes of the egg. How increasing the oxygen. So there is reactive oxygen species in the during the egg formation, which again damages our genes. So we need to understand this. Diabetes, it affects the egg quality. Then, if the female gets pregnant with a very high sugar level, there are high chances of congenital malformations in the baby, especially the heart. Heart is very commonly known to be affected in diabetic mothers. The heart of the baby is affected in a diabetic mother. And there can be many associated abnormalities also. So the sugar levels should be under control. A female gets pregnant. We need to definitely make sure the sugar is under control. Secondly, thyroid. Again, a very high TSH level can lead to cretinism in the baby.
Okay.
Again, medical conditions of the baby. Or it can lead to abortion if the TSH levels are very high. In fact, if we have the patient is suffering from hyperthyroidism, also it negatively affects the pregnancy. So even the thyroid level should be corrected before planning for pregnancy. Blood pressure. Nowadays, because of the sedentary lifestyle and so much stress in everyone's life, we are seeing females in the age of 30, 35 having a high blood pressure and starting on medication. So we need to be very sure that we are taking the correct medication because some medications which are taken during blood pressure negatively affects the growth of the baby. So you should consult your doctor and know which medications are safe if you're planning pregnancy, which medications are safe for hypertension, which medications are safe for diabetes and for thyroid if you are planning pregnancy. Because the medicines can also have a negative impact on the baby. So these are the
Uh,
conditions which the female should take care before planning.
Thank you, doctor. As you are mentioning, as we're talking about the women and the female infertility, doctor, I want to ask you is does the age of male partner also influence the fertility outcomes for couple who are trying to conceive? Are there any specific reasons behind it?
Yes, definitely. Male factor is also there. With age, like in a female, we can say 30, 35, the fertility starts getting affected. But for a male, I can say from the age of 40, beyond the age of 40, 45, yes, their fertility start decreasing. Again, the same reason. There also the sperm quality is affected. How uh, again the motility is affected, the genetic problem is there because of the imbalance of the reactive oxygen species and antioxidants. So these affect the genes of the sperm, and hence there is a abnormal sperm, and again that leads to either there will be infertility, no pregnancy, or an unhealthy embryo leading to miscarriages.
Oh, thank you, doctor. Doctor, another thing I want to ask you is so are there any available diagnostic test and evaluation method which is used to access the infertility in women?
Yes, the science has advanced a lot. First and foremost is a transvaginal ultrasound, and that too on a day 2 or day 3 of your menses. That tells us exactly what is the antral follicular count. We do a transvaginal ultrasound on day 2 or day 3 of the menses to look for the antral follicular count in the female, which is like the number of follicles which we can see in the ovary, like the number of follicles. in both the ovaries is more than 5, then we say the ovarian reserve is okay. So it's like if it is somewhere between 5 to 10 in both the ovaries, then the ovarian reserves are fine. But if it is less than 5 in each ovary, then yes, the females are having a decreased ovarian reserve. There is another blood test which is known as anti-Mullerian hormone, AMH. It can be done on any day of the menses. It is not related to a specific day that you have to get it done on day 2 or day 3. You can do it on any day, and it's known as AMH. That also gives us an idea about the ovarian reserve. But our diagnosis should not solely depend on AMH or on AFC. A combination of both the results helps us to diagnose better that what can be the ovarian reserve of a female being. Similarly, in male, as we do semen analysis, we come to know about the count, the motility, as well as the morphology, which is very important, especially in females. That how is the sperm looking? Is it looking healthy or not? And secondly, there is a DFI test, which also helps us, fragmentation index, which also helps us to find the quality of the sperm.
Okay. So, doctor, from all these tests that you have mentioned used, so this evaluation method, with that only, doctor, I want to ask you is that does this assisted reproductive technology commonly which is used for the age-related infertility? So, what are the success rates for women of different age groups?
Okay. Now I'll give you some scenarios through which I can explain you the success rate. If a female between the age of 25 to 30 is coming to us with a diminished ovarian reserve or a decreased ovarian reserve, then if we go for IVF with a self stimulation, with a self egg, the success rate would be better. It's like 30 to 40 to 50%. But a female in the age of 35 to 40 with the same ovarian reserve, with the same ovarian reserve as 25 to 30, here the success rate would be less. It's like 20%. Why? Because here, along with because of the age, the quantity is less, but that the quality is also affected. In the younger one, the quantity is less, but the quality may be better. So in younger one, the chances are better. In the chances are poor. But with the advancement and so much technology coming in, we have other kinds of facilities like a donor egg IVF program, where a female of the age 35 to 45, if her ovarian reserves have decreased a lot, then we can go for a donor egg. A donor is usually a girl, a female above the age of 20 and who already has one healthy child. So she can be the donor and she can provide her gametes, her eggs for this female. So we stimulate the donor, we do the pickup for her, take out her eggs, and then fertilize those eggs with the husband's semen sample in the lab, prepare the embryo, and transfer those embryos in the uterus of the wife.
Okay.
So the wife is giving birth, it's just the 50% the genetically the baby is not similar to the wife. Yeah. But yeah, she gets the uh, how do I say the joy of being a mother because she's
True.
carrying the baby for 9 months, she's delivering the baby.
Yes.
So the joy of motherhood is still there.
Yes, you said it right. The joy of motherhood, which is very important. Well, doctor, thank you so much for giving a lot of information on today's topic. Doctor, it's time to we take some questions from the audience.
Definitely, please go ahead.
Doctor, the first question I want to ask you is the person is asking what are the risks associated with delaying pregnancy to later ages?
Sorry, I didn't get you. Can we repeat the question, please?
The person is asking that what are the risks associated with delaying pregnancy to later age?
Still not being able to, the voice is getting cut.
Uh, I'm asking, the person is asking that what are the risks associated with delaying pregnancy to later ages?
Leaving the pregnancy to later ages, right?
Yes,
With
delaying,
with the
delaying.
because of the career, the female is planning to get pregnant later, right?
Yes.
Okay, it's a uh, see, females right now are also very career oriented. They want to focus on the career, and this age group of 25, age period of 25 to 35 is the age where you work maximum for your career, and this is also the age to become pregnant. Okay, so again, as we discussed, if we are postponing our pregnancies, our fertility is decreasing, and hence the chances of getting pregnant at a later age is, and there are more chances of abnormal babies, of babies with chromosomal problems like Down syndrome, Edwards syndrome, Patau syndrome. These are like different syndromic babies which are formed if the maternal age is high. If you allow me to discuss here, I would like to tell all the career oriented girls out there, key science has advanced a lot. If you all have not heard of this, please read about this. I'm giving you lots of information here out here. There is something known as oocyte cryopreservation, where you can get your eggs frozen. There are many centers who provide this facility. You can, if you're wanting to focus on your career right now, focus on your career, no problem. What you can do is get your eggs frozen. Go to your gynecologist. They'll explain you the procedure. We'll stimulate you when you are young. We'll do a pickup for you where we take out your eggs and freeze them. Okay? And it can be frozen for 5 years, 6 years, 7 years. Whatever, how much time do you want? And then later on, you can come when you are married. We can take out those eggs. We can fertilize it with your husband's semen and make embryos and transfer them to you. And yes, you can become pregnant at the age of 38, 40 with the eggs that were taken out 6, 7 years back.
Well, doctor, it's a very important information, especially for the girls in their 25 to 30,
Yes. So
because
do consult your doctors and see what's your ovarian reserve right now. How's your ovarian reserve?
yes, true, doctor. Well, thank you so much for answering this, doctor. Another question I want to ask you is that the person is asking, are there any lifestyle factors that can mitigate the impact of age on female fertility?
Yes, definitely. Definitely. Lifestyle is a very plays a very important role. And we should be taught this at a very younger age. Frankly speaking, I have seen in my practice right now, with so many years of practice, I have seen the young girls. There was a era where the young girls, they wanted to look like zero figure and very lean and thin, and they used to go on strict diet.
Yes.
Strict diet means like skipping breakfast and like starving themselves till they attain that kind of figure. But and that has negatively impacted their ovarian health. Let me tell you that. I have seen young girls who do that. And then when they come to us at the age of 28, 29, or 30, their ovarian reserves are very low, as if the age of their ovaries are 40.
Oh,
So, getting my point, girls out there, at a very younger age, when you're starving yourself, you are causing a deficiency, which is leading to premature ovarian failures in your body. So, a good, nutritious, healthy diet is very important since a long time. From the puberty, in fact, you should take care of yourself with your diet, your sleep patterns, and definitely exercise. Exercise should always be a part of your lifestyle. So, you should, if you are having a very good lifestyle from a very early age, that is from your teens, if you're following a very healthy lifestyle, trust me, your egg quality at the age of 38, 40 will also be very good. But you have to follow a very healthy lifestyle from your teens. Getting my
correct.
point?
Yes.
So please live a very healthy lifestyle, girls out there. Follow a good diet, a good. And nowadays, I have seen the dietitians, they give a good nutritious diet. Instead of starving yourself and not knowing what diet to follow to reduce weight, please follow a good dietitian. Go consult your doctor. They'll give you a good diet plan, which you'll have a fulfilling, good nutritious diet, as well as you will lose your excessive weight. So it's important to maintain the BMI, do exercises. Definitely, your eggs would sustain a lot. for a longer time.
Yes, thank you, doctor, for answering this. Doctor, another question we have. The person is asking, what advice or recommendation do you have for women who are considering delaying pregnancy due to personal or professional reason? You have already answered this, doctor.
Yeah. So I told you, please go for cryopreservation. It is a boon for you all, for the all career-oriented girls out there. And if you all are already married, there is another option. If you all are already married, you are a couple, but don't want to conceive now, you can get your embryos also frozen.
Okay.
Means we take out the eggs, we use your husband's semen sample, we make the embryos, and the embryos can be again frozen for 10 years. So you can use that frozen embryos just to get it transferred in your uterus later on.
So for those who are newly married, they can plan their journey of being a parent together by this method.
Exactly. Yes, exactly.
So yes, thank you, doctor. There's one question that we have received. So, if is there a specific age when women should consider consulting a fertility specialist if they are having difficulties conceiving?
Okay, so yeah. So for this, what we say, if the female's age is less than 30, and if the couple has been trying for a year and still not being able to conceive, yes, please consult a fertility doctor. And if the woman's age is more than 30 and a couple has been trying for 6 months but still not being able to conceive, then after 6 months, you should immediately consult a fertility doctor. So if you are less than 30, you can wait for a year. But if you're more than 30, wait for 6 months and then consult a doctor immediately.
Thank you so much, doctor, for answering all the audience questions. Doctor, it was a very wonderful session. We wholeheartedly thank you, doctor, on behalf of my team as well as the Human Biological Institute for sparing your most valuable time with us. Thank you once again.
Thank you. Thank you so much for having me.
Thank you so much, doctor. And I know a lot of people who are watching this are benefited from this wonderful session. I wholeheartedly thank our viewers as well for being with us in each and every session. We request all of you.
I hope it was of some, yeah, I hope it was of some use. And if you all have any other queries regarding oocyte cryopreservation, embryo freezing, or anything related to infertility, or please feel free to connect me.
Sure, doctor. Thank you so much. Thank you to all the viewers. With that, I wish everyone a very good afternoon. Thank you so much, doctor.